Our digital solution, Protera Health, has been able to help health plans drastically lower rates of ER utilization and orthopedic spend for their Medicare Advantage members through our fully digital solution. And the question is, how do we do that? It all comes down to being able to engage Medicare Advantage members successfully through digital health. So I'm going to give you our top 5 techniques at successful engagement for Medicare Advantage members using digital health. Number 1, humans. Too many digital health solutions focus on the technology part and not the human part. That may work with some populations and some demographics. But what we've found when you're dealing with the Medicare Advantage population, you need to have a very strong human component. That member needs to feel like they are talking to a real person, or better yet, a real care team that will respond to their concerns and help guide them through not only the technology portion, but their actual clinical condition. The more technology facing that the solution is, or the more it feels like a bot or an AI-led companion, the less effective it's going to be at driving engagement. You may be able to engage a Medicare Advantage member for a couple sessions with such automated tools, but you will not get a 3-month program in that manner. You really need to have a human first component. Our second piece of advice is to do multi-channel engagement. Now, what does that mean? I already said how the human component is important, and that can be accomplished through a synchronous, live, telehealth digital format, where you're actually engaging with that Medicare Advantage member in a real dialogue and real evaluation. But that's not all you need to do. You need to make sure there's other ways to engage that Medicare Advantage member to keep the program fresh. That will include an engaging web portal where the member has access to their education and exercises and other helpful information, but also other types of communication, typically electronic, of course, such as newsletters, other campaigns, and even webinars. When you do this, you create a novel experience that keeps that member hooked for the 3-month program, which of course gives you the highest chance to improve their clinical condition, promote lifestyle changes, and treatment adherence. Number 3, you need to share data with the Medicare Advantage member. What does that mean? That member wants to know what their performance is at baseline and how it changes throughout the program. As I've mentioned, we have a 3-month program and we collect clinical outcomes at baseline, 6 weeks and 12 weeks. When we collect that 6-week data and the 12-week data at the end of the program, we make sure to share it with that Medicare Advantage member so that they can see how they're improving from a pain, function, and mental health perspective. This is really critical for them to understand that what they're doing the program is resulting in meaningful improvements. And if it's not improving like they want to, they have a care team that can help guide the way to figure out how to course correct. This has been critical in engaging members. And we all know when we take care of patients, the more data we give them, the more they feel bought into the program. And it's no different from a digital health approach. Number 4, web portal, not app. Now, you may think this is totally out of left field, but what we've found is that using a web portal is a far more engaging experience for Medicare members than a smartphone app. Now, we're all used to using smartphone apps on our phone, and it's pretty customary that if you have a technology solution, it's going to be through an app. However, we've found that web portals are far more effective. Now, why is that? Well, the secret is that Medicare Advantage members are not uniformly using their cell phones. In fact, many use tablets and laptop computers to engage with our service. Smartphone apps that are designed for a mobile interface are not as effective on a tablet or on a computer device. Therefore, we have found it's much better for them to engage where they feel comfortable. And for them, it can be any of those 3 mediums. So my advice to you, ditch the app, embrace web portal. And there are ways to make the web portal feel like an app on the navigation through use of bookmarking. And we certainly do that with every one of our members. A lot of our members, they want to experience Protera Health on their computer with a big screen because they're doing live sessions with our physical therapists, and they want to have the full field of view when they do that. Finally, number 5, include family members. Now, for a typical 25-year-old using their smartphone, they don't need help or they don't want help from a family member. That is very different for the Medicare population. What we found with our Medicare Advantage members is that it's not uncommon for a husband or a wife to actually rely on their spouse to help log in every session, every appointment. And so we need to make sure to engage that family member or spouse or whoever the support is on how to use the program and engage them with the program itself. This leads to the highest adoption for a population that you would never think would adopt digital health technology. And so getting that early access to family member, finding out who that support person is, will be critical in driving a 3-month engagement. So these are my top 5 tips on how we've been able to drive surgical grade improvements in pain, function, and even mental health without having to do any surgery whatsoever, bringing down costs, driving up outcomes, and driving up patient experience and member experience along the way. If you found this content useful, it would mean a lot to me if you share this with your colleagues or friends at your health plan or other organizations. And of course, feel free to reach out to me directly to discuss more.